Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, everybody, and welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo once again. How are you, doctor?
I'm very well, Luis. Thank you so much. How are you today?
I'm doing great. Beautiful weather out there.
Amazing.
So today we're going to talk about anti-aging. Is that correct?
That's correct.
And how the stem cells can help with us getting old. That's something we cannot avoid, right, doctor? Getting old.
There are two factors with anti-aging. So we deal with intrinsic and extrinsic factors. Now, what does that mean? Basically, it means our internal environment versus our external environment. We have inherently, as human beings, we have the normal wear and tear of aging and of cells. We have the decrease of the size of the telomeres. I'm sure a lot of our listeners and viewers have heard about that, which is a direct result of aging. And as the cells divide, the ability for the stem cells to regenerate themselves that are inherently in our body right now declines, and then our telomeres shrink, and eventually those cells die. And that's basically what I mean by intrinsic effect of aging. The extrinsic causes of aging are everything in our environment. So pollution, smoking, our diet, alcohol,
the sun.
The sun, absolutely. UVA, UVB rays. So a lot of different factors that can affect our aging process that are in our environment.
All right. And how, in terms of stem cells, how can the stem cells rejuvenate or keep us from aging?
Yes. So what the stem cells do is they will go in and replace the apoptotic cells, the cells that are dying. We do have a normal process of regeneration of cells. And so cells die after a certain lifespan and they need to be replaced. And as we age, that happens less and less and less. So what the stem cells do is they go in and regenerate the stem cells themselves, as well as regenerate the damaged tissue that hasn't been regenerating on its own, again, from the normal process of aging and wear and tear. So the stem cells go in, regenerate themselves, regenerate damaged tissue, and that's how we undo aging, essentially.
Okay, and these can also work in cosmetic purposes, right?
That's right. That's right. So it works on tissues and organs, skin, as I said, tissues and organs, angiogenesis. We have angiogenesis, which is the production of new blood vessels, which is so important in creating new tissue as well, and as well as cosmetics. So, and that's done intravenously as well as topically.
And since we are in the topic of how you administer these stem cells, in this case will be through IV, right?
That's a very good question, Luis, because it can be done in a number of different modalities. So definitely IV. We do an intravenous infusion of an amazing cocktail that we have a proprietary cocktail that combines exosomes, growth factors from the patient's own blood, other key elements along with the stem cells, and we combine that with mannitol so that when we do an anti-aging treatment on a patient, we're not just addressing the peripheral body. We're also addressing the cerebral and cognitive function as well. And so that involves getting the stem cells to the brain. And that's really important, because if we didn't take that into account and use a natural sugar that helps us do that through the bloodstream, we wouldn't get the stem cells to the central nervous system. So it's really important that we do that with the IV, as well as in some cases we will do an intrathecal infusion of the stem cells, which is a very safe and effective method of getting the stem cells to the central nervous system through the blood-brain barrier. We do that very effectively with a lot of neurological conditions as well as intranasal aspiration, which is really important also as another mode of getting the stem cells to the brain very effectively through the, like a nose spray of stem cells. So those are the ways that we have the stem cells having that anti-aging effect cognitively as well as to the tissues and organs and skin and so on and so forth.
Is it fair to say, doctor, that you're never too old for stem cells?
You know, that's very correct, because we have a very common misconception that, well, I'm too old to regenerate my body because the decline has occurred. And that is absolutely not the case, because with stem cells and with brand new stem cells, with the way that we do our treatments, as well as preparing the body and actually rejuvenating, bringing the body back into a rejuvenated state, even pre-stem cell, what makes us so unique at the Stem Cell Healing Institute, because we have this whole pre-treatment protocol that involves oxygen and detoxification and hormone therapy, case-dependent hormone therapy, that really allows to create the best internal environment for the stem cells to have their best effect. And we do indeed see a great response with elderly patients, because there's so much room for improvement. We actually see, 80-year-olds doing better than even a 30 or 40-year-old, because they have a longer way to improve. So that's how we approach the treatment.
So it is a fact then that the stem cells can slow down the aging.
Slow down aging, absolutely. Yeah. we don't want to slow down anti-aging. That's right. So in that process of allowing regeneration of hormones, of tissues, of the anti-inflammatory effects, that's really important to take note, because the stem cells allow the anti-inflammatory effect of the body, which that in and of itself slows down the effect of aging. And so we have that effect. We have the creation of new blood vessels. We have the, again, with the regeneration of the damaged tissues and organs, we have the removal of dead and necrotic cells. So we have a renewal there. And so, yes, absolutely. To make a long answer to a short question.
Doctor, you do have a very comprehensive treatment package. What does include this package?
Yes.
And how long does the patient have to stay in Guatemala for this treatment?
That again is something that I'm asked very often. As I alluded to earlier, our treatment package includes a pre-treatment and a post-treatment protocol, which can last up to 3 months. But of course, the patient is not in Guatemala for 3 months. We only need the patient in Guatemala for 7 to 10 days, depending on what we are treating and the degree of treatment and the condition. So we have the patient in Guatemala 7 to 10 days. We do a pre-treatment protocol that involves a nutritional detox IV. We call it our total detox program, which combines natural suppositories and nutritional intravenous infusion of amino acids, antioxidants, vitamins, minerals, as well as B vitamin shots. We do appropriate, depending, again, a condition appropriate oxygen therapy, which could entail either hyperbaric oxygen or exercise with oxygen therapy, as well as hormone therapy, usually in the form of growth hormone therapy. Again, this is all very personalized depending on what the patient requires, and dosages and numbers of sessions, as well as a stem cell enhancement formula, which is a personalized herbal mineral concoction, antioxidant concoction that allows for the preparation and the stem cells to just keep humming along as long as we can possibly keep them going. And last but not least, we often and we always involve some sort of emotional, psychological, mental exercises that help the patient to prepare the patient for healing. We see so many sick and chronic patients that have been chronically ill for so long that sometimes they don't know when they are feeling better, and they don't know how to perhaps even behave when they're feeling better, or they even acknowledge when they're feeling better. So that's a really important aspect of healing.
And since you're talking about the patient feeling better, what would be the manifestation of the patient after the stem cell treatment? What would the patient feel after the stem cell treatment as far as anti-aging?
Yes. So we see physical improvements in skin texture, tone, color, laxicity. We see in many cases more hair. We see in many cases darker hair, so hair that has turned gray changes color back to its original form. We see cognitive focus, concentration improvements. We see many cases where eye health has improved. I have one patient in particular that mentioned to me very specifically that she had to reduce the size of the font on her screen.
Really? Wow.
After stem cell treatment. So that was phenomenal. We see endurance improve, libido improve, hormone situations improve, overall improvements in many health conditions that we don't specifically target. However, we see improvements in.
Okay, doctor. Anything else you would like to add to this podcast?
I think we've covered a lot of ground today. I think we have. If there's anything else that you think that might be useful for our viewers and listeners,
just to let them know that in case you have any questions, or if in case you want us to do a specific podcast, you may send us an email. By the end of this podcast, you will find all the information how to contact Dr. Figueredo, and also all the social media of Stem Cell Healing Institute. So in case you want to send an email, Dr. Figueredo will be more than glad to respond. Thank you, doctor.
Thank you.
And please don't miss our next podcast, which is going to be about respiratory conditions.
That's right.
So you have a nice day, doctor.
Take you, Louise. You too.
You take care. One. Bye-bye.
Bye.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.